Hello, hello. Welcome, everyone. I'm Emmy Grimes. I'm an advisor here at Senergy Medical Group. We have the amazing Dr. Marshall Olson, DDS, joining us today. I'm so excited to have him here. We have a great topic we're going to be talking about. He has known the Tenant family for over 20 years, right, Marshall?
Yeah, 20 plus.
Oh my gosh. Well, yeah. I'm so thankful. It's going to be a great topic. We try to bring you the best information. So let's just dive in and, get this party started.
Awesome.
So how did you get connected with Dr. Tenant?
Yeah, it's a great question, Emmy. I met him a little over 20 years ago when my youngest child was sick. Oh. And so he treated her with the biomodulator, one of the first generations of the biomodulator. She was under 2 pounds at birth, struggling to survive, really. And I honestly think he saved her life, really. She's 20 years old now, in college, and typical annoying 20-year-old kid. But yeah, I met him that long ago. And since then, I've always wanted to learn from him, and had the pleasure of being close enough to hear a lot of his teaching and learn how to use this and incorporate it into my own practice. So it's been a huge blessing.
Oh, I know. I was just going to say, what a blessing. How cool is that? And to be able to save your own child, that's amazing. Yeah. Well, we're so glad you're here. Thank you so much.
Yeah.
I think the first question I want to ask you is how does dental health affect our overall health?
Okay. Yeah. So your mouth is basically, it's a gateway to your body, right? That's how we get food in there. We breathe through our mouth. And so everything in there is connected. So whatever's going on in the mouth is going on elsewhere. And studies are now showing that. We're seeing things where oral health problems are related to everything from Alzheimer's, dementia, arthritis, diabetes. It's all in there. Even emotions get stored in the teeth, especially negative emotions that get trapped in there. And so your mouth can tell a lot about your overall health. And so if we can keep that area healthy, hey, it's a good place to start.
Right? I know, it's like a report card, basically. What is the difference between a biological dentist and a regular dentist? We get this question often.
Yeah. Yeah, I get that question too. People come in like, "Hey, what are you saying when you're a biologic dentist?" So the biggest thing is that we're trying to figure out and really pay attention to how your oral health relates to the rest of your body. We want to look at things like inflammation, toxicity, what materials are being used in your teeth and in your mouth, so that we can keep that overall health on the whole body. So that's the biggest. I think the biggest difference is we're trying to stay conservative, figure out how can we help the oral cavity to better relate to overall health. So really focusing on that relationship.
Good. How do you evaluate what needs to be done, with a patient coming into you? What special steps are done to assess the situation too?
Yeah, so we spend a lot of time, probably more than your typical appointment, where you're coming in and getting checked really quick and teeth poked and then see in 6 months. We want to spend a lot of time talking over like your health history, dental history. Where have you noticed changes? How does it relate to the chronology of that? Like, well, I got sick. Okay, well, what happened before that? Oh, I happened to have a lot of dental work done right before I got this treatment done. So we want to review that health history quite a bit. We use technologies like cone beam X-ray, cone beam scans, muscle testing, blood work, compatibility testing, a lot of things to try to figure out what if anything's going on in the mouth that could be related to the rest of the body or interfering with enjoying an overall healthy lifestyle.
Yes, living our best life. Well,
Right.
And that brings me to my next question. Since you brought up cone beam, what is a cone beam scan or CBCT scan, and how does it compare to like an X-ray?
Okay. Yeah, great question. The cone beam scan is a 3-dimensional image or scan that we can take of the jaw and all the teeth. So it allows us to look for things that in a regular X-ray, which is 2-dimensional, and gives us a lot of information too. But the 3D cone beam lets us rotate the tooth. We can take cross-sectional views. We can really hone in and see where and hunt for is there a hidden infection somewhere that's been missed with two-dimensional imaging that now we can see and clearly define and treat to solve a lot of problems. So that cone beam scan, while it's a big scan, and it also gives us a ton of information. So the value on it is without, it's hard to say how much it's worth, right?
It's priceless.
Yeah.
Yeah, it's priceless for sure. I agree. I mean, it is giving you that roadmap to determine where you are, where you stand, and where you need to go, basically, it sounds like. So my next question is, how is an extraction different in a biological sense? You know, what does this do for the body as well?
Okay. Yeah, the extraction process, which everybody's really excited, right? If the dentist says, hey, you need an extraction. What we want to do is make sure that traumatic event of removing the teeth, especially if it's an infected tooth, how do we get the body and give the body what it needs to recover quickly, less pain, and get prepared for eventual, if we need to replace the tooth or at least keep you healthy. The biggest difference is we're going to use things like ozone therapy during the procedure. We're going to use platelet-rich fibrin, which we're collecting stem cells, healing factors from your own blood, collecting that and using that to place back into the extraction site to help generate what we really want is circulation and proper healing. And then it does really well when we pair it up with like the biomodulator to get that healing and get that voltage back up into that area if we want to talk voltage.
Yes, that's great. That's awesome. Well, I do have a question here coming in just a second about that. So, but I did want to ask, because this was brought to our attention, can amalgam fillings be removed safely? Something we want to know.
Yeah, the answer in short is yes, to a certain extent, right? We do put a lot of safety protocols in removing the amalgam fillings. And the reason we want to remove them is that up to 50% of them, of that filling material by weight is elemental mercury, which is extremely toxic material. And mercury vapor is released when you're removing those. So we use protocol in place. There's two different main protocols we use. One is called SMART, and the other one is just called PROTECT. But essentially, we want to isolate the tooth, remove it safely, extra suction, filtration, to try to capture as much of that mercury vapor as we can while we remove that toxic substance from the teeth.
Very good. That's good to hear. Now, we get this often too. If someone has a root canal, should they leave it alone or do they need to remove it?
Well, I think that question, ideally in an ideal scenario, you wouldn't have that, right? You wouldn't have the root canal tooth. When is the right time to remove it depends a lot on the health condition, age of the patient. We know the root canal tooth, once the tooth has been root canaled, it no longer has circulation, no longer has nerve innervation. So we know it's going to have a higher bacterial load that's going to stress the immune system, stress the body. So in that, when in reviewing everything, looking at radiographic imaging, looking at the health condition, what meridian that tooth is tied to, that would really determine on when and how soon we'd want to remove the tooth. But my personal preference is just not to see those root canal teeth in the mouth.
Right. That's right. Can I treat, this is talking about voltage question, but can I treat a dental infection with the biomodulator and see results?
You can to a certain extent, and I think it goes back to what we were talking about with circulation just a minute ago with like a root canal tooth. The biomodulator is going to increase voltage to the area. It's going to give the cells the energy it needs. But to get rid of a dental infection, a lot of times it's going to require an in-depth and unfortunately sometimes surgical intervention to really remove the root cause of the problem. So yes, the biomodulator can be used as a treatment, but as far as full treatment, I think it also requires some some hands.
Yeah, hands-on action, right?
Hands-on action in there.
Well, that's good, and we've got some resources. That's the good news. So, you know, I know people are often scared of the dentist. What, you know, in general, what can they do if they can't afford the dental work?
Yeah, good question, and that comes up a lot. And obviously, that it's important to look at it from a preventive standpoint. I think at first, obviously, if you can do little things which tend to be less expensive up front, like getting checked regularly, making sure your diet's well, making sure you're giving your body what it needs, then dental appointments don't necessarily need to be super expensive in that regard. But there are ways, if you're at that point where we need to intervene, there are services out there that will finance dental care. You can also break it up into smaller sections, focus on things that are more urgent first, and try to work around it. But most dentists, we're not all bad people, eh? We want to help you out, and so there are ways there are workarounds and financing options that can help people get it done, where it's not such a burden for them.
That's good to hear. Thank you for letting us know that. And how do I find the right dentist in my area? Because we help people all over the world. So I would love to hear from your thoughts on that.
Yeah, finding the right dentist, I think it does take a little bit of work. You're going to need to research things a little bit and ask some good questions. What's great is there are organizations out there that help train dentists in these types of treatments in biologic dentistry. There's some really good organizations out there. I think with people who are following Senergy, it's really easy to just contact you guys. And you guys have done a lot of that research and legwork for them, and you can give them some ideas on how to find someone close to them, and help them find the right kind of treatment, the right kind of dentist for them.
Fantastic. Yes. And lastly, I understand for those local people out there, or even coming to visit the Tenant Institute here in Dallas, you've got a practice down the street from us. You know, tell us what you can offer the Tenant Institute friends out there.
Yeah, so we sit really close to the Institute, and we've got it set up because we do know a lot of people come from far away. They're on a time schedule, and we don't want them to miss out on all the amazing things happening at the Tenant Institute. So we do have things set up at our practice where if you call and let us know, or contact us and let us know when you're coming with the Tenant Institute, and we have special appointment slots set apart. We can work around things. We can do part of the exam and then follow up with Zoom or a phone call to go over things like the cone beam scan, because those can be long appointments, but we can break them up, and we're always willing to work around people's schedule, especially when they're coming in and working with such an important part of the group with the Tenant Institute. So
that's fantastic. They're like a VIP customer, basically, or patient.
Yeah, they are. They are. We know, well, the reason they are is we know they're really focused on getting well. And so we want to make sure that the teeth are not burdening that journey of getting well.
That is fantastic. Well, guys out there, please contact us. You know, I know that Dr. Marshall is an amazing guy, and he'll shoot straight with you and give you great information. So thank you again for being here today and explaining all that. Is there any last words you want to mention to our viewers out there with you know, when it comes to dental health?
Just make sure you brush your teeth. You know, brush twice, floss once, and eat right, and make sure you give your body what it needs to take care of itself. That's one thing I've learned from the Tenant folks and Senergy, is that your body has what it needs to take care of itself and get well. You just got to make sure you give it the building blocks and things that it needs. So I appreciate being on with you guys.
Oh, thanks so much, Dr. Marshall.